So welcome to module 6 of the Little Brushes Guide, and today we are going to talk about two important things. One is tongue cleaning and the two is mouthwash. So tongue cleaning. I come from India and we are from Kerala in India, and our culture, it is a norm for everybody to brush their tongue or clean their tongue. I have even seen people who don't have, like all the gadgets. They use either they cut a small piece of the banana leaf or from the coconut leaf. The middle bit, there is a middle bit of like a bit of a, you must have seen broomsticks with it. I don't know if you do see, it's the middle bit of your coconut leaf. We use that to clean the tongue. So I've always thought that tongue cleaning was a norm until I came to the UK, and I realized that that's not a norm. So most people get a tongue coating. A healthy or unhealthy person gets tongue coating. The tongue coating, the color, the thickness, the kind of bacteria on it depends on how healthy you are, if you are on any medications, if you use any particular mouthwash, the kind of food that you eat, the kind of hair retrieval you've got. So a lot of things dictate the type of tongue coating. It's usually from a combination of the food, the saliva, the posterior nasal drip, the phlegm. A lot of things come together, and obviously the bacteria all come together. We always, with the tongue cleaning, it is gaggy. It's gaggy for me after all these years. I'm 45 years old, but I would recommend that you do it, because now there is a wealth of information about the fact of the mouth bacteria being associated with systemic disease. So for about 50 years, we know that gum disease causing bacteria triggers diabetes, and diabetes triggers gum disease. So we know that for about 50 years. But in the last 10 years, evidence has come out that the mouth bacteria is associated with Alzheimer's, dementia, heart disease, stroke, Parkinson's, many diseases. So now there is an all the more importance for cleaning your tongue. Recently as well, there is, not recently, in the last couple of years, an evidence has come through where they checked the occurrence of aspiration pneumonia. Pneumonia is when the mouth saliva is taken into the lung, and it is taken, the saliva is not meant to go into the lung, and which causes an infection called as pneumonia in the lungs. And they found that these were people without no teeth from care homes, and the difference between people who clean their tongue and did not clean their tongue, and there was a higher risk of aspiration pneumonia in people who did not clean their tongue. And so again, there is a lot of evidence coming through for tongue cleaning. It is not nice, like I said, but it is something that is very well recommended. You want to start with the tip of your tongue, but you want to work your way. So in the first week, just use the tip of the tongue. The second week, use your tip and a little bit further. And like that, slowly, you've got to try and clean all the way to the back, because that's where most of your bacteria will stay. Also, cleaning the tongue really improves your taste sensation. It gives you better breath. So most of bad breath. So if you are a person who's got bad breath, try starting with cleaning your mouth. Obviously, properly is important. Cleaning in between the teeth is very important. And cleaning the tongue is as well very, very important for halitosis or bad breath. And so again, it is very, very well recommended. Just quickly going through the types of, you can either use, so for children, this is what I use for my children. So a brush, like a brush. Again, you can use your electric toothbrush working, your electric toothbrush not working, a separate manual toothbrush. I use this particular one, but there are the metal ones. So the metal ones, you can either have the triangle shaped metal ones or the U-shaped metal ones, or plastic ones, or just toothbrushes. Whichever one you use, it doesn't matter, as long as you do an efficient clean and you're getting it really clean. So that is my recommendation, and I would recommend that you clean your tongue twice a day. I have an Oral-B IO9, and that's got a tongue setting. So I use that for cleaning my teeth. But you used to get a triangle shaped brush head that goes on the electric Oral-B toothbrushes, but I don't have an Oral-B brush handle anymore, but that may be something that's available as well. If that's something that you fancy, you can try and get that as well. So that's about the tongue cleaning. Let's talk about mouthwashes. I stopped recommending mouthwashes for people because was thought to be as a replacement for brushing. And I don't think so. Like I was telling you earlier, Block is a very well formed community. It's an organization. You can't really disrupt it very quickly with just a mouthwash. Otherwise, people wouldn't be having gum disease or decay. So it needs proper brushing away, proper scrubbing away. And then once the plaque has been brushed away, then you can use an antibacterial mouthwash to avoid it collecting back quickly. Consider mouthwash like having a shower and then putting deodorant or antiperspirant on so you don't perspire. But if you don't have a shower and just put the deodorant on, it just masks the smell and it doesn't do anything. The same with the mouth. If you brush properly, then you use a mouthwash, it's efficient. But otherwise, it just masks the smell for some time. It's very important to make sure that we don't ever use a mouthwash after brushing, because the toothpaste has got 1450 ppm of fluoride, and most of the mouthwashes have about 200 or 150 ppm of fluoride, and you don't want to wash your good toothpaste with your mouthwash, especially evenings and nighttime. So it's really important that you leave your toothpaste in the mouth after brushing. So you just spit out, but don't rinse your mouth out. If you wanted to use the mouthwash, like I did explain earlier, you can use a good regime for brushing is flossing, interdental brushes, tongue cleaning, and at that point a mouthwash. Please don't use an alcohol-based mouthwashes because they dry your mouth out. So I don't recommend using any of the alcohol-based essential oil mouthwashes. It's not my preference. My only recommendation would be actually Sensodyne Pro Enamel, this one, and Dentile. These are the only tooth mouthwashes that I found in the market that's got 450 ppm of fluoride. So again, the most important times I would recommend these to be used is after anything sugary. So for children, after anything sugary or acidic. So these are the two times that I would recommend that you use a mouthwash, or actually after any food. Adults can use this as well, or before your electric toothbrush and toothpaste, and after the interdental cleaning and the tongue cleaning, you can use the mouthwash as well if you'd like it. Mythbusters: mouthwash alone is good enough and can replace brushing. That is wrong. It's like having a dirty plate, and if you put it under water, but it's not going to get clean, you have to take a scourer to it. It's exactly the same. The plaque is very, very adherent. You need to clean it physically off, and then you can use mouthwash as an adjunct. Mouthwash is to be used twice a day after brushing. That's the only time we shouldn't use mouthwash, like I did explain to you a little earlier. Children can use mouthwash only from the age of 6 years. Again, you can judge your child. We are just trying to make sure that all of the mouthwash is spat out and not swallowed. But that's why the mouthwash does not have a high concentration of fluoride. So just make sure that the children do spit the mouthwash out fully and not swallowing. And that's the only thing. So that's why 6 years, or whenever you think your child is ready to spit that mouthwash out, you can get them to use the mouthwash. So that is all for the module today. I shall see you in another module soon. Take care.